So we've brought back Dr. Robert and Dr. Walker for our question segment. Lauren, let's start with you. Great information. How the hell do we get the confidence to start talking about this conversation?
So I think it's a challenge to know where to start, and I think a lot of people are really reluctant to communicate about sexuality. Mm-hmm. We live in a culture that simultaneously plasters it all over the screens to sell all the products, but then also says, "Shh, don't talk about that. We don't want to hear about that. That's not appropriate," right? And so I think one of the challenges is we don't have any practice. How can we expect to be good at communicating if we've never communicated with people? I also think the stakes are high. People are nervous to directly talk about it with their partner. And so the more we can actually build up our skills to just talk about sex more generally, the better. So maybe it's you watch something on television, you read a news article, bring that up with your partner. Hey, did you see this? That was really interesting. Talk about it with your friends, right? So that you can actually build up from a more theoretical perspective what's going on with other people. Yeah. And then you're not so worried about what are they going to think about me specifically with those details? And from there, you'll get much more skilled at being able to talk about it more confidently.
So start small steps.
Absolutely.
And then eventually you can talk about it with your partner.
I would not suggest trying to have that conversation while you're in the sexual moment. So if you're trying to give feedback, I don't like
forwards the mood more than, by the way, I've been meaning to ask you while you're doing that. So pick your time and place.
Yes. Absolutely.
Take small steps. And if you are not able to, between you, make some moves forward, make some moves forward, there is a place, a space, and people that can help.
Absolutely. Whether you access those kinds of resources, sex therapy and counseling alone or with a partner, it can be really helpful because we can talk about what could you say, how would you frame that, how would you respond, even if your partner doesn't want to go with you to therapy.
Okay, excellent. And I am hearing more hum. Maybe it's because there's three of us. Dr. Robert, can we talk about hormones and pain and chronic pain and the link around that?
Wow,
We've got two different topics going on here, and we're just going to balance the tightrope.
That's an excellent question.
Thanks. I'm paid highly to be here to ask that question today.
Because we know the link is definitely there. We know that especially around the perimenopause, we see an increase in pain in women. It's fascinating. And there's this amazing article. I thought it was amazing because I found it quite...
Because you wrote it?
No, actually. I wish I had. But it compares fibromyalgia to perimenopause. And it comes around saying, which I don't agree with, by the way, but the idea that fibromyalgia is almost an extreme of perimenopausal symptoms. And so we do know, though, that hormones do play a role in chronic pain. Where they play that role is a little bit more uncertain, and we think it probably plays more of a role in what we call modulating. So it's not a direct one-on-one role unless you have pain with your periods, and we can talk a little bit about endo later. But otherwise, it kind of facilitates. It's a little bit like, let's say, oil for the motor. Everything, in this case, it runs in another direction, rather than actually run the motor. But what we do know is oftentimes just supplementing hormones or altering them is going to have not as much of an impact as we want. But for example, we know the role is there because women who are menstruating, migraines increase before your periods, fibromyalgia increases, IBS increases, all those pain increases, and we know that pain thresholds will change through the menstrual period, and we know that pain spikes around that menopausal time. But we've not been very good in manipulating hormones and having a huge impact on pain.
Yet if men had chronic pain every 28 days...
the story would likely be quite
we would
different
have that
than
shit dealt with. Okay, have we got some audience questions for either Dr. Robert or Dr. Walker? Okay, hi. You're not on.
Thank you for your
There you go.
presentation. My question is for Dr. Robert. Thank you for your resources that you've provided in your presentation. I'm thinking of the spouse, partner, family members living with a person with chronic pain. And I'm assuming that those resources would be helpful for those individuals as well. But do you have any others that are spouse, more focused on the spouse and living in that milieu and environment where, in particular, a person living with chronic pain who hasn't obtained satisfactory pain management?
That again, you must have been reading my mind. What I didn't talk about is how pain impacts everybody around you, right? Your loved ones, even the society you're living in, and that impact around everywhere. With the Alberta Virtual Pain Program, we are actually developing a webinar to look at people who are in that role, living with people with chronic pain, and how can they help? How can they empower? What is the impact on them? So what I would suggest is that is just right now being developed as we speak. And if you see me at the booth, we have a sign up for where we can update you when that would be available, and we could provide that resource. But I think that is an excellent question that's often been neglected. So thanks for bringing that up.
Good one. Good one. So you can talk to Dr. Robert and her folks upstairs. Do I have another question? Okay, there we go. Hi.
Hi, I have a question for Dr. Walker about being safe in your body and feeling embodied and how it affects your sexual desire. Because I think women can feel very, I don't know, even that there's something wrong with them, that they don't have the desire and feeling, but they maybe don't realize that they are not even safe in their own bodies, and that's why maybe they don't feel anything in their own bodies. So can you please comment on this?
Feeling safe in your own body and the impact that can have on sex.
Absolutely. I mean, there's a couple of different components here. So for some folks, if you don't feel safe in your body, whether that's you've had a trauma history perhaps, or you're quite critical of yourself and your body, it can impede sex, sexual function, sexual arousal, just even being aware of sensations. Especially we overlap with what Dr. Robert was talking about earlier with chronic pain. For folks who have a relationship with pain, they may have learned to shut out certain sensory experiences and may not be aware of things until it's screaming really loudly at you to pay attention. I mean, we're socialized to just push through, right? And so we can either become totally desensitized, that we are not aware of anything happening, or we can become really hypersensitized so that all the little things are really demanding our attention. And when those are largely negative, right, that's going to take our attention away from being able to enjoy our experience. And so if folks are really disconnected from their body, and that can be quite an adaptive, protective mechanism that our bodies engage in and our brains engage in so that we don't have to pay attention to things that are difficult, that can make it really difficult to feel anything good and to be aware of those sensations. So a couple of things to consider if mindfulness meditation is an option, if it's something that you're familiar with or that you've learned about. There are lots of resources that are free, that are available to help people learn to develop more connection between their mind and their body and noticing sensation. But it is a skill. So it's not like we can just say, oh, I'm going to be more mindful right now during this sexual experience. We need to become more mindful in every aspect of our lives, and we need to be diligent with practicing meditation practices to build up that skill to pay attention. And then the other thing is, if we are paying attention and it is becoming something that is quite negative or catastrophic, we have quite a big reaction to that, then we could look into more counseling around how do we manage that? What kind of thinking might we be engaging in that's actually causing everything to kind of run away or go down that sort of black hole with very little control and very little rationality around balancing how we think about or perceive those situations. So a big question that you've asked with a few ideas about where to start, but certainly feeling safe in our body, feeling safe in that context with our partner with whom we're engaging is so, so important. Thanks for bringing that up.
Good one. Yeah, good one. Wait, we got another question? Oh, over here. Thanks.
Hi, my question is for Dr. Robert. I've seen some research recently that suggests that the majority or a high percentage of chronic pain cases are of the neuroplastic form that you discussed, and that those are more or less fully recoverable, potentially. Is that consistent with your research and experience?
Oh, that neuroplasticity
That
thing.
neuroplasticity. Everybody with chronic pain has had changes that's happened to their nervous system to some extent or another, and that really will depend on the chronic pain experience that they have. And so, to me, like you said, this is incredible hope to say that there is the possibility to then use that to our advantage to bring that nervous system back down, and that's where the research is going. There's a number of ways that can happen, and there's more and more research into how we can make it happen more. Whether it's one way, I don't think things are black and white. We can have acute on chronic pain. We can continue to have this, what I call, now we're going to get into vocabulary, that nociceptive pain, so that sensory input that's coming in, and that's a place where we start. But then there are absolutely changes that happen at the level, so it's always there, and that is where the excitement, because that's where people can be empowered, can make those changes to bring that back. And do I think we can bring it back 100%? How far really depends, and everybody's a little bit individual. It depends a lot on your experiences, on other things that are going on as well. But I think that's a message of hope.
Oh, yeah.
Absolutely.
100%. 100%. That's a message of hope. Any more questions for you? Because we can break for... Oh, okay.
I just had a general question. For people in chronic pain, with your friends, family members, just in society right now, I'm finding we're, I guess, kind of losing empathy, and I'm learned a bit that has to do with we're all in this burnout mode, and at one point, our buckets are full.
Yep.
And I'll just use my dad as an example. He's always complaining about his knee and stuff. And I'm just sort of, I'll just be honest, for personal experience, sometimes I'm just like, okay, Dad, I can't hear it anymore. Sorry, I'm just being honest. And I just, I've got lots of and I'm wondering about all the other, people suffering from chronic pain, and it's really sad, actually, because, if I was in that situation, I'd be devastated if my family and friends are just kind of at one point like, okay, God, I can't hear it anymore. And it's a really sad, I don't know what it's a question
It
as
is,
much as
but
a sort of a
caregiving
yeah.
burnout is so huge. And even if you're not a full-time caregiver, you're on the receiving end. Is someone watching a hockey game on their phone? Like, are you hearing that?
There might be people outside talking.
Okay. Okay. So caregiver rehab, of course you're topped up because you've got that on top of everything else. So give yourself a bit of a break. Like, you're feeling bad about this. Give yourself a bit of a break, because all of us, do you think I want to hear about teenage angst anymore? No, right? But of course you want to be empathetic and supportive. So give yourself a little bit of a break. But Dr. Robert, for someone around chronic pain and around empathy and understanding, your resources again?
Yeah, so first, thank you for your honesty. I
Yeah.
think that you really, I think, said something that most people are afraid to say. So I think that was really very, very real. I'm going to change the vocabulary a little bit here from when we have empathy for people. If we have too much empathy, we do get burnt out. And I want to change that to compassion, where we can be compassionate to people, but we don't get burnt out by it. And that means the difference is we can help people, we can to a certain degree feel their pain, but we don't own it. And so let me take the example of your father, who I've never met. I don't think.
Oh, you don't know him. We all know.
Maybe I've met him. I don't know. But where I would come at it from a let's say from a daughter is I would first acknowledge the pain that he's having, and then the next conversation is about what can I do to help you, but recognizing that he shouldn't be helpless. He's not. But that you can be there and be supportive, but then that's all you can be. And then after that, you have to let it go, and it's back in his court. And you can give information about where to go for chronic pain management, but it will always be up to him to make that decision about whether or not he wants to explore it. And that's all you can do. But you can always be there. You can always be supportive. You can listen to a certain degree, but it always comes back to his court. So this is the part about empowering. I think people with chronic pain do need to take that agency back and not to give it to somebody else. And that's really, really important.
And you could refer him, right, excellent, yes.
Thank you.
And you could refer him and help him navigate a pain management program, and even support him while he's doing that, so that he can then take on more of the agency for being responsible and learn about managing his own pain. So do you feel like you've got a bit more of a resource in your overflowing bag?
Do you mind if I add?
Yeah.
So I don't just do sex work, sexuality-based work.
I'm not sure you want to use the phrase sex work.
Thank you. So sex isn't the only thing we talk about. I do a lot of couples-related counseling. And I think what can really happen when we are trying to be empathic and supportive to one another is that we also don't differentiate between just providing emotional support to someone and then like the need to help them solve their problem. And I think we get frustrated because we're like, well, you've told me that 10 times already, and I told you to go to the doctor or go to physio or go do this, and you're not doing anything that I told you to do. And that can be quite frustrating. So I think recognizing that it's not our responsibility to solve someone else's problem. But we can still be emotionally supportive to them. And the more that we can validate, yes, that must be so hard. I'm sorry you're going through that. Like to offer those kinds of statements. And other than that, maybe just like, is there anything I can do to help comfort you or soothe you, but not to solve the problem? So maybe it's, do you want me to bring you a heating pad, or do you want me to just sit with you, or do you want me to just listen? We can do that, but we can't solve their problem.
Right. And nor should we try to take that on to solve their problem. So those are excellent tips. All right, we've run out of time for our Q&A, so we're going to head into our lunch break. So those of you who get your free bagged lunch, first 300 who signed up. If you have a ticket, you can head up to the mezzanine and collect your lunch. Don't forget to put your name into the prize draws in the mezzanine level. We've got prizes from Soma Haman Spa, Sophie Grace, Annex Ales, and Loss. We'll do a prize draw at the end of the lunch break and another at the end of the day. And we'll be back at 12:40 with our next presenter. So we'll see you back in here at 12:40.